Hi everybody, this is Jon Conley, your State Affairs Director for the Alzheimer's Association in Florida. As week 9 of the legislative session winds down, we are facing an extension for the 2020 legislative session in Florida due to continued budget negotiation. While most of us enjoyed a sunny weekend, the House and Senate budget makers continued to work out their differences, and I am extremely happy to say that it appears that the Alzheimer's Association has had another successful year, which ultimately serves the hundreds of thousands of individuals, families, and caregivers who are impacted by this disease. As of this filming, the House and Senate have agreed on a budget, and it looks really good. Overall, there is an increase of just over $7.6 million over last year's budget for the Alzheimer's Disease Initiative and Alzheimer's research in Florida. As part of that increase, there is increased funding for respite care, adult daycare programs for patients with Alzheimer's, a new $1.5 million allocation to the University of Florida for research, and $319,000 for the operation of the association's brain bus. In addition to the full funding for the brain bus, the other big news that I'm excited to share with you all is that late last week, both the House and Senate approved House Bill 835, which establishes a position of Dementia Director at the Department of Elder Affairs.
Read the next bill.
Committee substitute for House Bill 835, the bill being titled an act relating to Alzheimer's disease.
We'll prepare to vote. Senator Brandis. Senator Simpson. Block the board, record the vote.
39 yeas, 0 nays, Mr. President.
House Bill 835, in addition to creating a new senior-level executive position at the Department of Elder Affairs, also updates the name of Orlando's Advent Health Memory Disorder Clinic in statute, ensuring that this MDC receives designated state funding. It also has provisions which requires that all state agencies provide assistance, when needed, for the Alzheimer's Disease Advisory Committee. House Bill 835 also has provisions which revises the formula that Elder Affairs uses to distribute funding for respite care by lowering the age of the county population factor from 75 to 70 years of age. This change is the start of several incremental steps that will ultimately reprioritize dollars for respite service to individuals who are impacted by younger onset Alzheimer's disease. We are grateful to have been able to work with our legislative and executive branch partners to pass this legislation. And I would like to especially thank our sponsors, Representative Matt Wilhite and Scott Plakin, Senators Kelly Stargell and Audrey Gibson, as well as Secretary Prudhomme and his staff, our Governor Ron DeSantis and his staff, as well as the legions of other individuals who helped get this piece of legislation across the goal line. As the 2020 legislative session winds down, we won't be providing updates as frequently, but look for future policy updates and informational short videos coming soon. I would like to thank the Alzheimer's Association Public Policy Team, our communications team, and all of our volunteers, staff, and advocates for their engagement this session. We wouldn't have been as successful as we have been without the engagement and support of you all. Until next time, take care, everybody.